I think what excites me the most around digital health is it provides an opportunity to collaborate with patients in a way that I otherwise couldn't. All of the data that patients generate around them, if used the right way, can really help me to sort of tailor a sort of specific the health plan to that patient, because we're able to just collect a lot more individualized data, and I'm also able to deliver that healthcare and collaborate with the patient in different ways than we would be otherwise. So it is very exciting. We can change the way that we deliver care, and we can change the type of care that we deliver through digital health. I think what is important to remember though is that digital health is health, right? It's digital healthcare is healthcare. It's a tool in our toolbox, and it's not this big different sort of scary thing that is an outlier. It's really sort of part of what we do, and it has the potential to make care better for everybody. I think that in terms of improving the experience for patients, virtual care really provides some additional options that people didn't have before. And so, we think a lot about access and convenience in primary care, and it's something that traditionally primary care has struggled with, I think, frankly. So, to be able to, offer a same-day virtual visit for our patients, where, they don't need to come in 5 days from now, but we can turn those visits around much faster. And so seeing the patient more on their timeline than ours. I think patients like that. We know that patients like that. And the other side of it is really just convenience. Even for someone who's young and healthy, it is an inconvenience. You may need to miss time from work to sort of drive in and sit in the waiting room and get roomed and be seen and whatever. It's a good, it's at least an hour out of your day in the best circumstances. And so, as we've been doing a lot of virtual care, a lot of our patients are doing their visit from work, from their job. If they have an office, they'll kind of close the door and have some privacy and do that. A lot of patients will go to their car and do their virtual visit from their car, because it's sort of a safe private place, and they can just do a 20-minute visit and then go right back to their job without necessarily missing anything. So, access and convenience are really important for patients, and we understand that. And I think virtual provides us with a way to do that that really enhances the care delivery for everybody. Honestly, the best thing that I could sort of take away from this, if I look back in 20 years and say, what was that digital health thing all about? Is people say, what do you mean digital health? Because it's just part of how we deliver care. There's nothing special or fancy or different about it. Providers are doing it, patients expect it, payers are paying for it, and it's just part of healthcare. So I'd like to see the technology really fade into the background. The experience should be seamless. It should be simple. The tech in the back end can be incredibly complex, and there's people that need to worry about that. But in terms of the experience for the provider and the patient, we really want that to just disappear. Technology should be an enabler. Digital health should be an enabler, not something that we have to sort of kludge through. So that's how I see it going, and that's again, if we do it right and we incorporate good design and patient feedback and really design this well, I think that is what we're going to end up with, is a system that looks like that.